We're going to move now on to community engagement and information dissemination. And our first one is going to be with our Borderlands Diversity Fellows, and it kind of ties in a little bit with the previous presentation.
Hello, my name is Abraham Venegas, and I'm a Master's of Library Information student, grad student.
Hi, my name is Paula, and I am also a senior. I will be graduating with a major in Family Studies and Human Development, and am a diversity fellow. Sorry.
I am Sarah, and I'm also a senior who'll be graduating. And I might be the only veterinary science student here, so that's fun.
Hi, everyone. My name is Bianca. I'm an incoming first-year medical student, but I'm finishing up my master's degree in cellular medicine.
So, Discapaz, which stands for Disability Experiences in the Borderlands Project, um, our project is based on sharing perspectives on disabled peoples on the Arizona-Sonoran border, because we felt there's a lack of research and theoretical understandings and just any information on disabled communities on the borderlands. So this project to the University of Arizona Libraries called the Borderlands Initiative, with this project and as well as our partnership with Arsobo, Mariposa, as well as Artworks, we were able to develop a project with community members on the borderlands, specifically Nogales, Arizona, um, Arizona, and on the Sonora side, and being able to develop our workshops and having communities come and participate in these workshops to better um, pass that information to advocates, to policymakers, as well as folks involved in the working with disabled communities.
So it was very crucial for us to work with community partners. Our community partners helped with recruitment, and we were very fortunate to work with community members from the Nogales, Arizona side and the Nogales, Sonora side. So as Abraham had mentioned, we worked with Zachosobo, which is on the Sonoran side. We work with Mariposa Community Health Center, which is on the Arizona side. And then Artworks is a program under the Sonoran Center for Excellence in Disabilities that we worked with that helped us with the workshops for creating scrapbooks. We did see a range of about 11 of 55 years of age with the community members that we worked with, which was very interesting because we saw a very diverse group of people with very diverse ideas, which was incredible. We also offered these workshops in both English and Spanish, and also Mexican Sign Language, which was very important to be able to help them get their ideas across to the scrapbook and be able to communicate with them. We we did all of our workshops in these community health centers sorry. So we did our workshops in Arsobo, and we did our workshops in Mariposa. We went there in person for about 3 times last semester to be able to help them with the creation and just facilitation of the workshops and also the scrapbooks.
Yeah, so just like Paulette was saying, the workshops were actually the first part of our process. Our process can be broken up into 3 phases, really. And the workshops that we conducted, we did, the Arizona side in the morning. We would go across the border to the Sonora side to do like another 3 hours at that second site. But along with these workshops, participants were able to have like a support member, and we had Yumi and Elizabeth from Artworks come in, and we all kind of collaborated on making these presentations that were centered around themes like community strengths and weaknesses, um, activities of daily living, just a wide range of things. And these were offered in both English and Spanish. So then, participants were able to collaborate with their supporters and create a scrapbook. And phase two is more or less where we kind of are. We want to take the scrapbook and turn it into a digital sort of story. And so we went back again. The participants were able to have, the technology and like the camera and everything they needed to put together like an 8-minute long video of this process. And our last phase after that is just kind of the interviews and seeing where we can improve our process, as this has always been sort of a multi-year endeavor.
Okay, so this project is still ongoing. So right now we are in the process of making the digital stories with our participants, which should be done within the next week or so. And after that, we will move on to conduct interviews with them. And once that is finalized, we will, within the next month, I believe, we will launch them on a platform where they will be accessible for the public to view. And we just hope that with this project, we're able to share and raise awareness to the community. And I also just want to give a shout out to Marissa and Kimberly for helping run the workshops that we used the modules for. So that was great. And that concludes our presentation. Thank you.
Thank you. All right, our honor students.
All right, well, it's a pleasure to be here, everyone. My name is Carlos Castellanos Mendoza. I'm a sophomore studying information science and technology.
Good afternoon, everyone. My name is Justin Begay. I am currently studying psychology and minoring in sociology at the W.A. Frankie Honors College here at the University of Arizona. I am also a Gilman Scholar and a Udall Scholar, and I'm also in the Ronald E. McNair Achievement Program, which will keep me here during the summer while we do our 10-week summer research project. And it's a pleasure to be here.
Yep, and so as students from the W.A. Frankie Honors College, we are part of this new certificate program in civic leadership. And in this program, we partner with a local organization and collaborate together on a project. So for this project, we had the opportunity to work with the Sonoran Center in Excellence in Disabilities. And in our meetings with the Sonoran Center, we were able to learn about all the wonderful programs and fellowships that and opportunities they could provide to students. And so not only that, but you're also able to learn about some of the certain struggles that the Sonoran Center faces. And one of them being is visibility on campus. So our project is a social media campaign that focuses on promoting the interdisciplinary training programs and trying to get more interest into the Sonoran Center. So moving on to methods, one of the ways that we sort of developed this project was meeting with the communications director at the Sonoran Center and the Honors College. And so over a 2-week period, we were able to identify university affiliated Instagram accounts whose audience might be interested in the center's interdisciplinary training programs. And so what we really wanted to do was to showcase these programs in a couple ways.
To follow up what Carlos was stating, if we look towards the center of the poster, you can see type of content. The type of content that would entail and be a part of the social media campaign would entail trainee interviews where they would discuss their interviews with the program and how it's been beneficial to them. And that would be all of the programs, that with the undergraduate certificate of developmental disabilities, as well as the fellowships, all the student training programs. Additionally, they would collaborate with active university Instagram accounts. Well, that's what we would do. We've already reached out to various social media directors, communications directors, and content managers, depending on department where they are on campus. Sometimes they have different titles, but so far the reception has been very positive. That includes Native SOAR, FACES, which stands for Fostering and Achieving Cultural Equity and Sensitivity. Of course, the W.A. Frankie Honors College. And again, we have positive feedback. And of course, many of you who use Instagram have seen the social media takeovers. And essentially what that entails is you're given the keys to the kingdom for part of a day, and you get to document a day in your life of what you're doing, depending on what program you are. And that was something I was able to do myself with Frankie Honors College. It was very exciting. I got to do it when I was studying abroad. So we were in Florence, and basically I had my phone and had access to the social media and just documented my day. And it was a lot of fun. So if we swing over to goals, you'll see that recruiting students into the training programs, that's one of our goals. Again, as Carlos mentioned, during our discussions, there were challenges, but also opportunities. So we wanted to show awareness of these programs for those other students on campus who may not be aware of them. And also increase Sonoran Center visibility of their interdisciplinary training programs, which I just covered, and educating the student population on the center's objectives. Because during our discussions, we found out that sometimes with students here, there are misconceptions about what the Sonoran Center offers. They're not the Disability Resource Center. They're not the SALT Center. Those are separate departments. And then creating new communities of students from various programs of study with, for example, the undergraduate certificate of developmental disabilities. It's students from all kinds of disciplines. So there's very open, and you come together with a common objective and you create a new community. And then also right below that, we have a chart, and you can see that Instagram amongst the college age demographic by monthly active users in millions. The blue shows Instagram on the left. They are the most commonly used social media app. In the middle, you see the red, which is Snapchat, which is less common, but still very popular. And then in the gray on the right side is TikTok, and that's gaining popularity, but it's not quite up there, but it's gaining. And then the discussion, Instagram again was determined to be the most used platform. And we want to make this information more accessible, present different opportunities for our students. That's the primary objective here. And with that, if there are any questions, you can scan the QR code on the left of our poster that has our Carlos's and I's contact information, our emails. If you have any questions, or if you're interested as in one of the programs, interested in taking part of the social media campaign, please reach out to us. And before we conclude, we have to acknowledge JC Farkas and Selena Urquez, who have worked with us, have been so supportive and kind throughout this project, as well as their communications director, Lizzie Jeffrey, as well. Thank you.
Thank you. Jocelyn.
Hi, everyone. My name is Jocelyn Watson. I'm a senior graduating in public health this May in a couple weeks, and I am a Sonoran Center intern. So with my project, I mainly have been working with Dr. Lynn Tomasa. She's affiliated with the Sonoran Center, and we've been working together on comprising a comprehensive workbook on sexual violence awareness for individuals with IDDs. So individuals with IDDs are 7 times more likely to experience sexual violence. So the main way that we decided to tackle this issue and to reduce the prevalence of this ongoing issue is to increase awareness surrounding this topic and to increase the amount of accessible resources available to individuals with IDD and the IDD community. So the main way we went about this is having different subjects for different parts of the workbook. And the main goals for that was to provide a definition for each section of the workbook, provide relatable examples that people could identify, like, oh, if this is happening to me, then going forward, and then resources that those individuals can go forward with. So with my process, I began research on the topics that I was assigned to, which were bullying and how to be a self-advocate. So going about this, there's a lot of research out there, but it's not very accessible for individuals or this community. So having to learn about plain language and formatting this information that I found
into plain language that's accessible was a pretty long process, just because a lot of the writing that I do as a student is academic writing and plain language is very different. So that was a little bit of a process. And then weekly meetings with my Dr. Lynn Tamasa. Sorry, I'm a little nervous. So we would do weekly meetings and I would receive feedback. She would give me support, let me know what was doing right and wrong, giving me some drafts and suggestions, more research to go into. And then it wasn't really a linear process. I had to go back and once I got that feedback, start a little bit over and then go through that process again, making those finalizations and wrapping up my sections. One of the main findings throughout this process was there aren't a lot of accessible materials and resources on sexual violence prevention and awareness for this community. This is a hard topic for anyone to want to go about. So having it for this community and for this, for this community, it's just there's not a lot out there. So there needs to be more done when it comes to addressing this awareness and providing education. And there also needs to be more awareness on plain language. It's a really, really great skill to have, and it should be taught more and utilized more. But yeah, basically the main goal and the main thing that I found during this process was that education is the key to prevention. Through that, we can raise more awareness on this topic, reduce this prevalence, and help heal all of our survivors. Thanks.
Hello, everyone. My name is Jordan Chilton. I am a senior with the Public Health College. Excuse me, sorry. I am an intern for the Sonoran USED. And my presentation is about updating the policy briefs for the Arizona Development Disabilities Planning Council. The last brief has information from like the 2010s type area. So I have updated it to the most current information. So 15% of the world's population has at least one disability, and in Arizona, 13.6% have at least one disability. So it's not very far off in difference. That's about 972,000 people. And I have found that there's about 207,000 Arizonans with disabilities are employed. So there's a big gap with that. Okay. So these policy briefs are beneficial to people with disabilities to understand. These policy briefs provide the most up-to-date information, bring awareness to the employment rates to the public and people with disabilities, and provides information dissemination for people with disabilities looking for employment. In my methods, I have a variety of websites that I utilized in order to collect this information. So having it all on one document is easier for information dissemination. And I've I've also found that little graph on the right is separating the types of disability difficulties, and the highest number of people with disabilities that are employed have cognitive difficulties. But on the flip side of that, the largest number of people that are unemployed are also people that have cognitive disabilities. Let's see. Oh, and a limitation of my research that I found very interesting was that the number of people with disabilities in Arizona is not entirely accurate due to the ever-changing definition of disability, and also people not being fully aware if they fall under the disability category. And there's also research where it's done on the computer, and some people with disabilities do not have access to computers. So the estimates for the number of people with disability is strictly an estimate. And also this update is really important because it brings awareness to employers about the need for accommodations to be employed. It brings awareness to the amount of people that have successfully been employed. And I've been very excited to work with the Arizona Developmental Disabilities Planning Council. Thank you.
Thank you, Jordan.